Good afternoon. My name is Keisha Pollack-Porter. I'm a professor here at the School of Public Health in the Department of Health Policy and Management, and I am thrilled to moderate this panel. Thank you to Wendy and Anne for inviting me to do so, and it's been great to work with you on this. I am especially thrilled to introduce our three speakers, which I will do initially, and then I will turn it over and we'll hear comments from each of them, and we'll have plenty of time for questions and comments. And this session is entitled Practice and Policy and Practice Opportunities for the Next 10 Years, Connections Throughout the Food Supply Chain. And it is really supposed to be a conversation for us to think about what are our needs, what's the vision, what's the future gonna look like. We spent our last hour talking about local systems, and we're taking more of a national perspective for this particular session. So before I introduce our first speaker, let me take a moment and make a plug that you all please complete your evaluations in your folders. You can leave them on the table or place them in the back before you head out today. And I will remind you of that when we wrap up again too. So, all right, so our first speaker today will be Dr. Kelly Brownell. And there are so many things I can say about Kelly, and I'll just say a few. I had the privilege of meeting Kelly when I was a master's student at Yale working on my MPH. But Kelly Brownell is the dean of the Sanford School of Public Policy at Duke University, where he is also the Robert L. Flowers Professor of Public Policy, Professor of Psychology and Neuroscience, and Director of the World Food Policy Center. Amongst his many accolades, in 2006, Time magazine listed Dr. Brownell among the world's 100 most influential people in its special Time 100 issue featuring those whose power, talent, or moral examples are transforming the world. After Kelly, we'll hear from Jason Lambros, and Jason is the partner and vice president of Coastal Sunbelt Produce Company in Maryland. Coastal Sunbelt is the leading independent mid-Atlantic supplier for fresh produce and dairy. Mr. Lambros joined the company in 1995 and currently oversees a team of 15 buyers responsible for all purchasing, inbound logistics, receiving, and rotation of over 160 million in produce and dairy annually. Our third speaker will be Dr. Susan Main, who I also knew from my time at Yale. Again, excited. A little Yale reunion here. Dr. Main is the director of the Center for Food Safety and Applied Nutrition at the Food and Drug Administration. In this position, she leads the center's development and implementation of programs and policies related to the composition, quality, and safety and labeling of foods, food and color additives, and cosmetics. So I will turn it over to Kelly for our comments, and each of the panelists will speak for around 10 minutes or so, and then again, we'll have plenty of time for conversation and questions. So thank you, Kelly.
Thank you, Keisha. I'm really happy to be here and was delighted to hear about this conference in the first place, because this connection of obesity, folks who work on obesity with people that work on food systems, I think could go some very interesting directions and highly needed directions. I came with a whole bunch of slides to show, but I think I'm not going to show them, and I'd just rather talk. And I'll start off by just saying a little story that will culminate in why we've created what Keisha mentioned in her introduction, the World Food Policy Center at Duke University. So when I went to Duke just about 5 years ago, having been at Yale for many years, and there was involved in lots of work on food policy, but it was mainly public health, nutrition, and obesity prevention. But it became pretty clear to me a number of years ago that there were lots of other things happening out there in the world of food that were affecting what went on in my area, like things like agriculture subsidies, for example. But I wasn't trained to understand those things. I didn't know the people that worked on that. I didn't know the acronyms of the organizations. So I set out to learn more, as much as I could, about a broader set of food policy issues and food systems issues. And that was really exciting for me, and it became pretty clear that the new people I was connecting with didn't know what was going on in our field, so there was this general lack of connection across areas of food policy. And it seemed that there could be some interesting niche for people to fill to try to bridge these areas. And so at that point, I had the idea of creating a World Food Policy Center that, instead of recreating depth on any one topic, like let's say food insecurity or obesity or agriculture, it would be a bridge across them. And when I went to Duke, I wasn't intending to do this because I'd been hired to be dean of the school, but I couldn't help myself, and I started talking to people about the idea, and some funders got interested in funding this, and so now we have a World Food Policy Center that's been launched for about 6 months. So as I said, the idea behind the center is to bridge areas rather than recreating depth, and it's a completely daunting enterprise because it's hard to be expert on one topic, much less a bunch of them. But every day, my increment in learning is unbelievable because I'm learning about engineering and food waste processing into energy, for example. I'm learning about small-scale sustainable farms and big-scale industrial agriculture and all kinds of things that many people know about, but it's interesting to think about how they all connect with one another. So in the context of this World Food Policy Center, we're going to be doing a number of things, including trying to create a digital network of people around the world who are interested in food policy issues, using AI and other techniques to try to create unique ways to unite people around the world. We're going to be doing some things globally, but what I'd really like to talk about first today is what we're doing locally. So we're funded to do now, and we're very excited to be working with a city, in our case Durham, North Carolina, and a rural North Carolina county, happens to be Edgecombe County, North Carolina, to see if we can create a model food systems community. And so we'll have one rural, one urban area to do this, and we'll see how the urban and rural systems connect with one another. But the hope is to try to take one place in the country and try to get everything right. Now, when I say one place in the country, a lot of these things are going on in Baltimore already. I mean, what I heard today was really very exciting. To hear about people working in the city of Baltimore, Hopkins people that are doing research on this, it was really very exciting. But there aren't many places like this where this kind of work is occurring. And so what does it mean in our minds to create a model food systems community? It means obviously learning about best practices from all around the world and importing that information into our community. It means scaling up things that work, scaling down things that don't. It means better connecting community resources, work of the NGOs with city government and state government. It means trying to create model practices around a certain set of issues. So for example, we have a summit meeting coming up soon. Several of you are attending on early child development and nutrition. That will bring together experts on brain development, child development, early child nutrition, and community intervention and policy, people that are really out there on the front lines in the community to see what would a model food systems community look like with respect to early child development and nutrition. Not long after that, we're going to have another summit meeting on food and faith-related issues. Our own divinity school happens to have a strong cluster of people very interested not only in theology and food and stewardship of natural resources, but also, of course, how churches can be used to deliver food assistance. So that summit could turn up a set of practices about what a model food and faith community might look like. We're also interested in topics that would bridge different areas and create wins across areas. By the way, I should mention what these areas are that we're focusing on. So we're clustering things into 4 categories that we hope to bridge, and these are arbitrary. You could have 2 categories or 20, but they're intuitive, at least for us. One is food insecurity, hunger, malnutrition. The second cluster is obesity and chronic disease. The third is a very large category of agriculture and environment, and of course there you get climate change, water, biodiversity, antibiotic resistance, et cetera. And the last category is food safety and food defense issues. New topics pop into the picture. In fact, Joel in his talk kind of gave a lead into this. Food waste is a very interesting issue because if you can successfully address food waste, you can help address food insecurity, obesity, and environment all at the same time, especially if you pay attention to what happens to the food that never does get consumed, even after your best efforts, because that food goes to landfills and creates methane and contributes to climate change. So the engineering of turning that food waste into energy becomes a very important part of the picture. So that's an example of what we're doing. One very exciting part to this is to see whether you can create a model food systems community with respect to innovation and entrepreneurship. So we spent a lot of time with people who know a lot about entrepreneurship and innovation in our area in order to see whether we can create a system of incentives for people to start new businesses, to have Durham become a hub for food-related innovation around the country so that people come to our community with good ideas who may not be there already. And these new businesses can get incubated into thriving enterprises. And one can think of all kinds of ideas of things that might be done where social entrepreneurship becomes the aim, and a lot of good can be created that way. And at the end of all this, what we want to do is to have a blueprint or a template for what might be replicated elsewhere, so that whatever we happen to learn in Durham will get evaluated, every which way, and therefore we'll have a good story to tell, not only through science, but through other means, qualitative and quantitative research combined, in order to let people know what might get replicated elsewhere. So that's the basic concept behind what we're doing. I thought of a dozen different ways we could collaborate with people here around these issues, because so much good work is going on here. And for the people at the Center for a Livable Future, this concept of bridging is completely not new at all. They've been doing that wonderfully for years. And the other thing I think that Hopkins does exceptionally well that we're very excited about is finding a systematic way of creating this positive feedback loop between researchers and change agents. And the change agents could be policymakers, elected leaders, but they could be state attorneys general. They could be people, activists working in the community. We heard from some of them before, city officials and the like. And so the model that we're using to try to make that happen in a systematic way is what we call strategic science. And if any of you are interested, I could send a little paper we've written on this. What it begins with is identifying change agents. And the change agents differ depending on what topic that you're talking about. So a change agent might be somebody in the legal system, it might be the head of a school system, depending on the topic. But finding out from those change agents which research questions can best be addressed and fill gaps that are important in their world rather than gaps that the scientific world finds important. Then the research can be done and you've got a positive feedback loop going to take that information and go right back to the change agents. So we've had very good luck with that kind of model, and it's amazing how sometimes quick, inexpensive studies that can be done in no time at all and cost almost nothing can have a big impact on policy if the right question is being asked. So that strategic science model is very important to us. And boy, did you see a beautiful example of that when Keisha asked the question of the panelists who were on the previous panel. And with no time at all to think about this, all three of those people came up with a set of really interesting research questions. And it's quite possible that those questions would never be identified in the scientific literature, but are very important in terms of changing actually how things occur. So creating a systematic way for that to happen is really very important to us. So I'm delighted to be here. I'm excited to connect even more than we are already with people at Hopkins, and thanks again for inviting me and having this interesting conference.
Great, thank you, Kelly. So let me welcome Jason up here. Are you going to stay there? Do you want me to start your video here? Are you going to come up?
I'd rather sit, yeah.
Okay,
If you
well,
don't mind.
you let me know when you want me to start it.
Oh, let's start with the company intro and then
All right. And so that.
One more time.
I didn't know it was doing that. Give me 1 second. All right. Although maybe people do want to hear it again. I did like the music. There was a version without
The Coldplay, yeah. So, thank you, Keisha. And I'm not really sure why I'm up here with these highly intelligent folks. I guess I'm the produce guy, and we're Coastal Sunbelt Produce. We've been in Howard County for 25 years. We've got some stat corrections. We now have over 20 buyers, and we're now up to $330 million in sales, and probably 1,200 crew members. And I like to, I pinch myself and think of growing from 7 people and 2 trucks to this, and I guess it's a good sign that there's a lot of fruit and vegetable consumption in our area, and it's amazing we've gotten that large. We're definitely a large produce company, but in the scheme of things, we're a very, very small food company. Okay, to put in perspective, Cisco, another broadline distributor, is well over $40 billion, probably much higher than that. So, but we're in a neat spot in the Mid-Atlantic. It's a strong area, growing area, diverse area. We sell restaurants up and down the East Coast, let's say from northern New Jersey to southern Virginia. And then we sell retail pretty much the entire East Coast from Maine to Florida. And we can do that by going to other distribution centers. So our little blue trucks you'll see in Baltimore, Washington, Richmond, Philly, probably serving over 2,000 restaurants from fine dining to quick serve. And then our big trucks would take produce to other wholesalers, distributors, and retailers up and down the East Coast. And then they'll take it to 100 supermarkets each. So we have a lot of visibility to the food system, at least the fresh produce. That's fresh produce and dairy is all I know and all I can speak to. And we see a lot of solutions. We see a lot of challenges. We see a lot of obstacles. We certainly know the cost to deliver, the cost to bring it in from source, and willing to be open and transparent about all of that. Hope you have a lot of questions, because I'm not a good public speaker. And but it's just a fascinating business. First of all, I'm very fortunate. I can feel good about what I sell. I don't have to have tricky advertising and tricky marketing. That's 25 years of marketing. We've barely ever advertised. We've grown via word of mouth. And we finally had something we had to do a presentation for, so now it's been used twice, so thank you. So we're excited about our future. We just built our newest building. We outgrew a 165,000 square foot building 10 years ago. We moved in 10 years ago. Our competitors said that's way too big for produce. You'll be out of business in a year, nice knowing you. So I'm glad they were wrong. We, in 6 years, outgrew the building, so we doubled it in size and tripled it in capacity. And we're hoping it could theoretically and someday move $1 billion worth of produce. That would be phenomenal. And we are not putting anybody out of business. All of our competitors from day one are still in business. So we're hoping that that just means the area is growing and that people are putting a larger portion of their plate to produce, whereas the obesity trends might say to the contrary, so we got to figure that out. And anything I can do to help and answer questions on the supply chain, that's what I'm here for.
Great, thank you, Jason. And so we will turn it over now to Susan. Let me get your slides up here. All right, great.
Okay, thank you. I really thank you for inviting me to come up and talk a little bit about FDA's role here. What many of you may or may not know is I spent 27 years in the academic world. I was a professor at Yale, as Keisha alluded to, and I've been at the FDA now for 3 years. And like Kelly, I've had an amazing opportunity to learn an awful lot about the food system and learning about the tools that the regulatory world has to try to impact in a positive way on many of the things that you're all very, very committed to. It's been wonderful to hear about all the different tools that you are using, the ways you're all trying to impact on that from the positions that we're in. So let me spend a few minutes about some of the tools that we're using at FDA and how we're trying to impact the obesity problem and through the food system as well. So the first slide is one that I just want to start with, and that is the center that I lead at FDA is called the Center for Food Safety and Applied Nutrition, and those are our two big mandates, food safety and nutrition. And food safety is by far the biggest part of the center. That's the big mandate that we do. Nutrition we also do, but it's on a much smaller scale compared to our work in food safety. And when I went to FDA, they were kind of like food safety and nutrition, these two different siloed kind of areas. And what I've learned over the last 3 years is that they are not siloed at all. And in fact, they are incredibly interdependent. And you'll see in the image here, I have the slide showing the produce. And we know that produce is a critical part of dietary guidelines. It's one of the most under-consumed parts of the dietary guidelines. We want consumers to eat more produce. I knew Jason was going to be here as well, so I wanted to highlight the produce. And one of the important things that I've learned at the FDA is in order for consumers to want to consume produce, we got to get the food safety right. And what I've learned from speaking with the produce community and with many of the growers is all it takes is one bad outbreak, and consumers get turned off to produce for a long time. You showed Salinas Valley. You showed the image there. I mean, many of us recall the spinach outbreak, the E. coli outbreak in Salinas Valley. When that happened, consumers stopped consuming spinach, and it took a long time for that to recover. And so our goal on the food safety side is to make sure that consumers have confidence in these commodities and the safety of these foods so that they will consume them. I frequently hear people saying, well, I might get a bacteria or something from this food, so I'm going to eat the Doritos instead because they're processed and I'm not worried about the food safety risk. And what they're doing is they're trading off acute foodborne illness for long-term chronic disease. And I think what our goal is to really address that so that we don't have to have that trade-off and we can have safe food, consumer confidence, and better nutrition for everybody. So one thing I wanted to highlight is how many people are familiar with FSMA? How many people in this room have heard about the Food Safety Modernization Act? So about half of you have. It's the most sweeping change to the food safety system in the United States ever. Basically, Congress told the FDA, write new rules to comprehensively overhaul the entire U.S. food safety system from start to finish. And there's a series of 7 rules that were put out by the FDA, at Congress's request, and one of those is the produce safety rule. And so for the first time, FDA is working very hard throughout the entire produce safety system to put in place what we call preventive controls. And that is to make sure that everybody in the produce system knows what to do, education, technical assistance to minimize the risks of foodborne illness and contamination. So focusing in on simple things like worker hygiene, or all the people in the fields using appropriate worker hygiene, biological soil amendments, things like manure, is it appropriately treated so that there's no, you're reducing the risk of foodborne illness. So all the way through the produce safety system. So that's a lot of the work that FDA has been doing. I spent a lot of my time visiting farms, learning about, the challenges in an Amish farm versus a vertical farm in an inner city, and how do we make sure that that produce is being done as safely as possible. So I'm not going to spend a lot of time on food safety, but I think it's an important point that food safety is integral, especially in the produce realm, to better nutrition in this country, and I've learned a lot, having spent that 3 years at the FDA. So now switching over to nutrition, which is where I'm going to spend most of my time here today. Having learned the regulatory world, and the actions that we take are driven by the authorities that we are given. And the center that I lead has authorities on food safety and on labeling. We're responsible for labeling of food. And in thinking about how do we use those authorities to impact on things like better nutrition in this country, we came up with a graphic to kind of highlight how we think about nutrition. And it starts with robust science. We are a science-based regulatory agency. About a third of my staff, my center, are scientists. These are folks who are, just PhD-level scientists working in the trenches. We start with science. We look at all the science out there around the world, not just within our center. We then apply those tools that we have through the FDA, things like labeling, and I'll give you some examples of that. And on the upper part, you can see that one of our goals is to increase consumer understanding, and I'll give you some examples of that. Ultimately, we hope that consumers will change behavior once they understand more about the food that they are consuming, and ultimately we get the public health outcomes that we all want, which is reducing diet-related chronic disease. And on the bottom side of it is using the FDA tools to create a more safe and nutritious food supply. And this would be Kelly's healthy defaults. This is how do we make a food supply that's healthier so that consumers don't have to make behavior changes to get better public health outcomes. And I'll give you some examples of the work that we've been doing to try to facilitate reformulation, to get healthier defaults, to make a healthier food supply in the first place. So I'll give you some examples of both of these. All right, the first one I want to talk about is the nutrition facts label. And it's been about 20 years since the nutrition facts label was first issued in the early 1990s, and it's hard to believe that prior to that time there was no nutrition labeling really on food. And after 20 years, the label needed updating. And one of the areas I've been quite engaged in over the last 3 years is updating the nutrition facts label. And the real goal here is to empower consumers with the information that they need to make healthy dietary choices. And I'm sure many of you have been following this over time. What's shown on this graphic is the existing label, the one that we've all known for the last 20 years on the left-hand side. And on the right-hand side is the new label. And hopefully the first thing you'll see is that it takes the same footprint, but what we've done is we've given much greater prominence to things that we believe are important to address the obesity epidemic and give consumers information. So the first thing you'll notice is calories, right? I mean, it just jumps out at you on this new label. We've also increased the prominence on serving sizes and servings per container, so it's very clear to consumers how many calories they're getting in this particular food that they are purchasing. And we've done it in the same footprint, and I think that's a really important piece here. There's some other label changes as well. Let me go on to the next slide to show you those in a little bit greater detail. Probably the most important one to this audience is the addition of added sugars for the very first time. We have had total sugars on our food label for the last 20 years, but the problem with that is a consumer, if you purchase something like a yogurt, some of that total sugar is lactose from milk, some of that total sugar is from the fruit that's used as a sweetener, and some of it is added sugar. And without this new information, consumers can't tell which is which. And so for the first time, consumers will have this information. We've been using the dietary guidelines for a long time to tell people to reduce their consumption of added sugars, and they didn't have a tool to really be able to do that. So that's a big, important new change with the nutrition facts label. There's other changes as well that I think are probably less relevant to this audience. We've also made a number of changes. For example, a 20-ounce soda now it has to be labeled as a single serving because consumers can consume that in one serving. So it's no longer that you're going to see calories based upon, 1 over 2.5. It's based upon the full 20-ounce soda. So a lot of changes have been made to really communicate to consumers what's in the packaged foods that they are eating. So that's one example of some of the work that we've been doing to modernize the nutrition facts label. Now that's packaged foods. We heard previously, but a lot of calories are being consumed away from home, in restaurants, in convenience stores. We heard about grab-and-go foods, in retail food establishments. And the national data we have that about a third of our calories on average in this country are consumed away from home. And prior to menu labeling, consumers would have no information about that nutrition content. So a third of your calories, you didn't know, how many calories or what was in that product. So as part of, I'm sure you're aware, the Affordable Care Act, Congress authorized menu labeling and told FDA to come up, and vending machine labeling, we saw some vending machines earlier. Congress told FDA, put forward regulations so that this will be labeled. And you'll see that the important term here is restaurants and similar retail food establishments. As you know, many cities and different localities had started this using chain restaurants to try to pilot this and to get consumers information. But it's not just restaurants where consumers are getting food on the go. It's similar retail food establishments. It's grocery stores like the Wegmans, where you can sit down and eat your food there. It's convenience stores where you see grab-and-go food. It's movie theaters. It's in many, many different settings. And so as part of menu labeling, that is what we are covering, is giving consumers that menu labeling information in restaurants and similar retail food establishments. And so as we've moved to implement the menu labeling regulations, we've heard a lot of concerns from the industry, and they've said, well, how can we do this? Like, in the buffet lines, we're swapping stuff out of the buffet lines all the time, and, this one goes out, this one comes in, and this is really hard for us to do. And we heard a lot of concerns from industry about, how do we implement this in the real world? And so FDA has been working very hard over the last year to issue guidance documents to tell industry the flexibility in the rule and how they can comply easily with the provisions in menu labeling. So the last guidance we released was in the fall, and it's a series of pictures. I've never seen an FDA guidance that is this heavy on photographic images and graphics like this. But it's showing, for example, these are some of the things we've seen as menu labeling has been implemented, and this is fully compliant with the menu labeling rule, is things like here you can put these little stickers on the sneeze guard that peel right off on a salad bar or a buffet. And so as things are swapped in and out, you basically peel it, gel cling stickers right off the sneeze guard, and that's an easy way to comply in a buffet setting. We've also heard what about, pick up foods in convenience stores and other settings? How can they comply? That this is challenging. So these are some examples of how they could comply. These are baked goods on display. They could be at a gas station, convenience mart, anything like that. And just showing the easy, facilitated way that people can comply with the menu labeling rule across the diverse landscape which people encounter. Another one we heard is that, what about for things like pizza, where you can have 14, different combinations or more, it's more than 14, you can have 3 different crusts, you can have 4 different sauces, you can have different cheeses, different toppings. How can they possibly comply with the menu labeling regulations? And so in our guidance, we showed many different ways that pizza establishments can come into compliance. You can see, for example, that there's ways to communicate based upon the types of crust. What would the calorie ranges be? Based upon the different sauces that consumers might choose, what would that add in terms of calories? Toppings, you can see that they're grouped, the meats versus the veggies, and showing the different calorie ranges. In all cases, there is what we call the succinct statement. I'll show you on the bottom of there. I'm indicating that what the 2,000 calories a day, that's the succinct statement, needs to be accompanying the menu labeling that you're seeing here, and that's so that consumers have some context to the calories that they're seeing in menu labeling. So this has been a big commitment, a lot of work at the FDA to try to get this fully implemented. The compliance date for restaurants and similar retail food establishments to come into compliance is this May. So we're 2 months away from the compliance date, and FDA is working very hard to help industry come into compliance with these regulations. So in advance of that, one of the things that we want to make sure that we have available is how do consumers use this information. If you go back to my graphic, giving consumers information is the first piece of it, but making sure that consumers can act upon that information is also critically important. And within the center, we have a consumer studies group. We do some of our own research on consumer message testing in advance of education and outreach initiatives. And I wanted to spend just a few moments talking about some of the work that we've been doing getting ready for menu labeling. So the first one, this is briefly a study design, some work that was done within FDA, and this was to help both get concepts as well as messages that we could test in focus group settings. And so we tested some different concepts, we tested different ads, we did this in 4 different regions in the country, we tested it in diverse groups. This particular one was done in middle-income mothers who went to fast food restaurants at least once per week with their children, and the children in this case were ages 3 to 10. And this was a complement to some of the work that had been done out of Tufts, and I know some of the folks are here, I believe, that also did this testing in low-income mothers. This is middle-income mothers. And so we tested a variety of we first did the concepts, and then we developed different ads, and then tested those in focus group settings. So the first concept, you can see eating smarter, not less. The second concept is about sharing portion sizes. And the third concept, you wouldn't dress them in adult clothing, why order them adult-sized meals in the menu labeling setting. And then we tested these in focus groups to see how they resonated across the different audiences that we were evaluating. And the impressions that came in, and you can see we did the different 8 test sites in different populations to see which messages had the greater resonance with the populations. And you can see the big winner by far was the first one. The second, that was the Eat Smarter one. The second message about sharing and caring, did okay, not as well as the first one. And the last one was negatively viewed across the board. And the comments we got back is it was preachy, we were telling people what to do, and it was not received well. And that's the importance of doing consumer testing in focus groups. So based upon this, we've developed that right there is the message that tested the best, again, is the Eat Smarter message. So based upon that, we've been developing messaging in advance of menu labeling. And the first one is we want to raise awareness. We want consumers to be looking at menu boards to know that the calories are there. So raising awareness is a really important piece of that information. The other piece is it's not only calories, but other nutrition information must be made available upon request. And so as consumers go into those settings, they can request, can you please provide the nutrition information on all the standard menu items? And that's part of our messaging to make sure that consumers know that. The next one is increasing awareness of daily calorie needs. We've done some work in here, and a lot of people have no idea what they need on a daily basis in terms of calories. So we're working on some messaging around that as well. And then, but again, needs vary. That's part of the messaging. And then the last one is encouraging healthier choices. And that's, kind of what I showed you before, things like swaps, simple swaps that consumers can make to order healthier in the menu labeling setting. So here's some examples. These are preliminary. This is all formative work being done right now in our consumer studies group. So this is an example. 2,000 calories a day is used as a guide for general nutrition advice, but calorie needs vary. And so that might be the type of messaging we'd want to get out there so people are starting to learn about daily calorie needs and requirements. Another one, this is an example of a simple swap message, simply showing that if you're in a restaurant and you ordered, you can see order a grilled chicken sandwich instead of a fried chicken sandwich, that's the difference in terms of the calories. And so a simple swap, giving consumers that information so that they can make healthier choices when eating out. And lastly, with the remaining time, I want to switch to the lower part, which is the safe and nutritious food supply. I've only just briefly highlighted some of the work that we're trying to do to give consumers information to really drive better nutrition in this country. Now I want to focus in on the green part, which is the safe and nutritious food supply. And specifically what I want to talk about is reformulation and our role in assuring both a safer and a healthier food supply. And one of the things we've learned is that labeling drives reformulation. And for example, some of the early work in menu labeling where people tried to assess the efficacy of menu labeling, they only measure what the behavior changes at the consumer level. What they haven't always measured is what has happened at the industry level in advance of putting those products into having to label the calories. So we know that putting things on labels drives reformulation. It's true with calories, it's true with added sugars, it's true with sodium, and it's been true with trans fat. And I think one of the best examples we have when people say, what's the evidence the labeling does anything? I hear that from, skeptics, labeling doesn't do anything. Trans fat, that labeling rule became effective in 2006. FDA put that on the food label. That was the only change we've made to the nutrition facts label in those 20 years. Trans fat was put on a food label in 2006. That led to an almost 80% reduction in trans fat exposure. And that's because industry started reformulating trans fat out of products and consumers stopped buying products that had higher amounts of trans fat. So if people say labeling doesn't, lead to changes, that led to changes. And a lot of scholarly work has now gone out looking at the impact of that change, just putting it on a label. And it's translated into tens of thousands of reductions in coronary heart disease events by one change on a nutrition facts label. We're also seeing with added sugars going on a label, go to the IFT meeting, the Institute of Food Technologists meeting, there is so much work going on non-caloric sugars and things like that. Same thing with sodium, with the intention on sodium. We are now seeing all kinds of innovation with sodium. They can now make a microsphere sodium crystal that has the same surface area, the same salty taste, but less sodium because of the way that they can formulate it. So innovation is happening because of labeling, and we're seeing changes in the composition of the food supply. And the last thing I wanted to say is just that I know this meeting is primarily on obesity, but I don't want to not say something about sodium. Sodium reduction is a really important strategy to prevent a lot of premature deaths and coronary heart disease in this country. FDA has been working to try to facilitate reformulation across the food supply. And sodium is quite tricky because it's in foods for a variety of different reasons, including food safety. It's a preservative in many cases. But nonetheless, what we're finding is there's excess sodium in the food supply, and we can get it down. And so what we've been trying to do is put out voluntary targets across 150 different categories of food, looking at top-selling products on the market and finding out, what is the amount of sodium that we think we can get it down to meet the technical effect of sodium in foods, but not expose consumers to excess sodium. So I'm going to end with that, but I just wanted to highlight a few of the tools and some of the work that we've been doing. This is the tip of the iceberg. It's a very, very busy place at FDA, but these are some of the things that we've been working on over the past 3 years that I've been working on. So I'll end at this point. Thank you.
Great, thank you, Susan. So I certainly have questions, but let me open it up. I'm sure that people are eager to ask some things to our panelists. So I know we have some mics roaming around. Question? Oh, we'll start here with Shriki.
This feels like a trivial question on Susan's presentation, but I feel compelled to ask it. I'm Shriki Kumanyika, Drexel University. Is it clear from your consumer research that showing people calories doesn't make them think they're not getting enough? And the type of the research I'm thinking about, especially that the teenage males and stuff, maybe they would need more, but the messaging seems to assume that knowing your calories will make you want to reduce them, but
I can start with that, and then I think I should turn it over to Kelly as well, who's done some work on this. I mean, I think, we all want to make sure that the messages have the impact that we want to have on menu labeling. There has been research out there. A variety of different groups have looked at that messaging. Some of the research that I'm familiar with includes Christina Roberto's research that tested things like the 2,000 calorie succinct statement. And so the scholarly work that I'm familiar with, laid the foundation for including the succinct statement, showing that consumers are more likely to make more informed choices in reducing the calorie intake when they have the context of the succinct statement. Having said that, we all know that there are going to be groups that are going to react differently to this messaging. We all know that. And I think one of the research needs, sorry, I'm losing my voice here, one of the research needs is interventions in specific populations to take advantage of what's coming with menu labeling to make sure that we can use that across the diverse landscape. I was a professor at Yale, and I know how many grad students react to that. They're like, "Can I get more calories for my for my dollar?" Because that's a population that has limited financial resources. We have to make sure that people are aware of those choices. A lot of this is focusing in on healthy, the simple swaps, how to get healthier choices. But I think there are needs in partnership with many different organizations, and FDA is going to be doing many public kind of private partnerships surrounding menu labeling, education, outreach, to make sure that we're getting the information to consumers in a way that they can act upon it and make healthier choices. I really hope the focus will be largely on healthy. I don't want to lose sight of the other nutrients. I don't know how many people in this room have gotten the additional nutrition information upon request that came along with menu labeling. I can tell you that's changed my purchasing behaviors a lot in the retail food setting. Products that I would view as healthy based upon the calories having astronomical levels of sodium, as an example. So I'm hoping that we can take advantage of all of this, the calories, the nutrition information, and really drive people to healthier choices.
Great. Do you have anybody else want to add something? No? Okay, great. I think there's a hand over there.
Hi, Julie Ralston.
So Michael?
No.
Julie Ralston Aoki with the Public Health Law Center. And this is a question for you, Dr. Burnell, and I hope I didn't miss this, but you'd mentioned this model community project with an urban community and a rural community. I was just wondering then if you could talk a little bit about, are there different things that you're doing with each one, or how that's working? And I wanted to also open that up to Jason, in case if you're working with rural communities, really interested in sort of how you're approaching food distribution there.
So we're now in the early stages of trying to figure out what a model food systems community would look like. So we're spending an awful lot of time in these communities, just meeting with people and talking with people to gain an understanding of what life is like. And so it's kind of early for me to answer that question. But one of the things that we think is especially important, one of the reasons, by the way, for having this World Food Policy Center that bridges areas is I think there is a potential to establish a much broader coalition of groups that could be arguing for food policy changes than what exists now. So, I mean, what exists now is you generally get the food insecurity world of NGOs and lobbyists pushing for certain changes. You have the public health community pushing for different changes, but not necessarily working together, and they're not working with the people that are working with big agriculture issues. And the opportunity to have a broader coalition is a very appealing one. So as an example, let's take the obesity field. So what is the obesity field focused on now? Calories mainly, sugar, soda, a few things like that. Those are the main areas of emphasis. But what if our goal were not to pick a particular type of food or a nutrient, but to build the strongest coalition across groups that could then argue for policy change? And so you might turn your attention to something like meat as an example. You get a benefit because of the saturated fat and the calories that come from the meat, but all of a sudden you've got this whole other world of people that now might be on your side and working with you on policy changes. Now, I'm not saying the obesity field ought to focus on meat as opposed to what it's focused on now, but it's an interesting question to ask about how can we build the strongest coalition, and how can we bring in players who ordinarily wouldn't necessarily be working with us. And so those are appealing things to do, and those things can be done in both rural and urban settings.
So to follow up on that, the logistics of food is mind-boggling. We spend a lot of time sourcing the best produce we can for our chefs and for our consumers. We're looking for flavor, we're looking for quality, we're looking for, obviously food safety has to kind of be the umbrella over top of all, and then you boil it down to your values and trying to align them with your broad-based consumer values, which is always tricky. Some are price, some are sustainability, some are social responsibility. So we're trying to balance all that. We're traveling literally to buy fresh produce, at certain times of the year. 50% of it's not grown domestically, so we have to be an importer. As you saw on the slide, we have to drive miles and miles to the Eastern Shore and hours to New Jersey and Pennsylvania and so on. So we're constantly sourcing. So there's the inbound side of the produce. Now, if you live in a warm climate or a four-season climate or a very cold climate, there's different local and regional supply, obviously. So to build that ideal model, it really depends on the values. It depends on the climate, the local climate. And, I've always given an anecdote that, everyone, this big local movement. I don't know if the spend has gone that direction yet. It seems to be ticking up. We move 1 million local cases a year. That's spectacular. I'm very proud of that. But I'm very depressed that that's out of 15 million. Okay, so there's a lot of logistical challenges. It costs, and I'm saying this in front of a multi-million-dollar customer, it costs between $5 and $10 to bring a box of food from California. It costs between $3 and $6 to bring a box of produce from Florida, and it costs about $2 to deliver it. So the economics have to function. All the consumer trends, I just got back from a food show, and all the consumer trends 20 years ago, 80% of people say they're eating healthier. 75% are putting more fruits and vegetables, say they're putting more fruits and vegetables on their plate, and on and on and on. You guys know them. And then the statistician goes, and the number one fastest growing food is cheeseburgers, and then pizza and French fries, and the Idaho contingent going, yay. But the number one driving force was actually price still, convenience still, finally this year, wellness nutrition really rose up, okay? Awareness of sourcing is rising up, local is rising up, at least in what feedback they're getting from the consumers. So that's all exciting, but the economics of distribution, it's low profit, it's high cost, and we could be considered a hub, we could be considered an aggregator, we could be considered a distributor. You know, there's a lot of different words and a lot of different phrases, but you got to look where people want to shop. You got to meet them where they're at. I love corner stores. I would love to get more produce in corner stores. I love churches. Great concept. Big institutions, big work facilities. Can we get boxes dropped off there? It really does not, as much as all that logistics costs, I need to drop 10 boxes of produce and hopefully make $2 a box, okay? So it's not a huge hurdle. The supply is out there, but shockingly, that last mile is just insurmountable in many instances. It feels like the demand's out there. So, you know, it's going to be I'd love to come down and see it. I see a lot of little pop-ups and a lot of little hubs and a lot of little local stores that thrive, but there's a microcosm or a niche that they're filling. But when I zoom out, it's not moving the dial that much. So we got to start tying it into more places where people want to shop. Convenience is king, time is money. How do we get it to them, I guess, instead of, because if everybody drives to the farm and picks it up, that's great for the farmer, but I think we just made 500 more miles on the environment. So what is the value of that ideal system is where I'd pose the question, but no answer, sorry.
Yeah, great. Thanks, Jason. Yes.
Hi, Mark Winnie. I'm with CLF, Center for Livable Futures. I'm going to ask Dr. Bernal. I seem to recall when you were at the Rudd Center that you were hitting pretty hard at the food industry and marketing and looking for some pretty strong regulatory responses. And as I recall, I went to your quotes at least 1 million times when I was trying to hit hard myself. I'm wondering what your current position is on that. How are you looking at the world of industry, big food, marketing, and the role of regulation?
Well, two answers. One is that as we're starting to think about broader food systems issues rather than just obesity prevention, it opens up a whole nother world of, agriculture and farms and things like that. And we're going to have to learn our way around that to decide, when to hit hard and when not to. And we're early in that process, so I don't know exactly where that's going to go. My impression with industry, interacting with industry, at least in the obesity area, is that industry is fairly slow to move unless they have a reason to do it. And the reason is generally a club an inch from their head. And so there has to be some threat, and then they'll take something seriously. I mean, there might be a little bit of movement because of incentives. There's a niche of people that want healthier food, so they'll create those as part of their portfolio. But I think for the most part, at least the foods that are contributing to obesity, there needs to be a threat. That could be bad public relations, it could be a legal threat, it could be regulatory threat, could be anything. And then they'll move ahead just enough to stay out of the way of the threat. And then the club has to be brought closer again to move them ahead sort of incrementally. But during that, there's a kind of an interesting space right during that time when they're incentivized to move and they're willing to do something because of the threat where you can work with them. And so I think, a lot of examples that, like Margot's done some really important work on nutrition standards in schools. Well, the companies were worried about bad publicity. They were willing to make changes in schools. So along come some really creative public health people that get into that space and make movement. And so that will bring you so far. And then the question is, how do you move them ahead beyond that? So that's kind of how I feel about it at the moment. Well, thanks for asking, Mark. And boy, you do good work.
Thanks, Kelly.
And one thing I can add too is I think FDA can help in some of these spaces because, like in the sodium world, what we heard is a lot of companies wanted to reduce sodium. They really did. And some companies started bringing the levels down in their food. And the problem they ran into is with so many super salty alternatives out there that consumers weren't buying the reduced sodium options. And so, it's like, can't we level the playing field so that everybody can start bringing the levels down and nobody incurs a competitive disadvantage with consumers? And so that's the kind of thing that we keep hearing. The other thing I'd say is we do have a lot of dialogue with industry, and I've really seen a big change in the 3 years that I've been there. And what I've seen, and I'm sure you've all experienced, is, consumers are increasingly demanding healthier foods. The messages are getting out there, and what you've seen is some leader companies, we had many that went out and supported FDA on things like reducing sodium publicly. Many industry companies went out there publicly and said, we support FDA's initiatives to reduce sodium. We had food industry companies that would be, you might think is surprising, companies like Mars saying, we support FDA putting added sugars on a food label. And I think it's really a business decision that consumers are demanding healthier foods, and they want to be, they want to be viewed as companies that are providing that and leading that initiative. So I think I've seen a real change in some of the dialogue that we've been having with, not the entire industry, but certain leader companies in the industry.
Great, thank you. Yes.
I have two questions. They kind of mirror what I asked earlier. Perhaps I should have been asking Coastal and the FDA. I didn't know you guys were coming on. This question is for Coastal, and I have one for the FDA. What keeps me up at night, really honestly, and what I've known for a long time is that the food industry, there's such a low profit margin, especially for produce because of the shelf life and having to keep it preserved. So my question for Coastal is, if you could dream up, imagine anything in your head to increase your profit margin, what would it be? The question for the FDA is food and drug. Drugs, prescription drugs are so entwined with our bodies and how our bodies digest the food, and certain drugs cause obesity. So the question for you is, have you all looked at that? Is that true, first of all? Is that just my perception? Is it true on a large scale? And how would you address something like that?
Well, I got one word, and it's Beyonce. So just like I said, I think coming back from that food conference, I saw an article that Beyonce is going vegan for 44 days, and she's got 112 million followers. And I'm like, woohoo! The influencers, I believe, I think transparency is everything. I think the labeling is a big step. I think corporate responsibility is hopefully getting pressured by consumers. The Internet of Things makes people aware and able to look up and access from all different perspectives. But at least it's like having a massive library. It's there if you want to go look it up. So that transparency is huge. And that's selfish for me because I think we sell something that's universally good for you. So that's a big win for us. The influencers, so the older athletes that influence a lot of people, Tom Brady, very known for his strict diet, and now he's winning Super Bowls at, into his 40s. And then, you've got the younger athletes. So Kyrie Irving, superstar up and coming, says he's vegan. So the plant-based diets are kicking in, and I hope a lot of people are asking why are these, machines, these people with ridiculous physiques are eating lots of fruits and vegetables. So that's good. So transparency, labeling, and then avoiding the just enough, good enough labeling that makes people, so a lot of food, you see the labeling just kick up a notch. And then this big swath of consumers go, oh, okay. So, and that's good enough for me. But hopefully it's the transparency, I'd say, is probably the best thing for our industry.
Yeah, and I would say you asked about kind of, profit margins, and you were asking about shelf life. And one of the things I'm seeing, and again, the fun thing of being at a place like FDA is I get a very wide view of many things that are happening. And one of the really exciting things that's happening in there is the new technologies that are being used in the logistics and in the food distribution system. So for example, manufacturers like, or distributors like Walmart are now using blockchain technology so that they can trace every single step of the food through the supply chain, and they can use that information to optimize, like if something is not moving quickly at this stage, how do I affect that? And they're using technology in new ways to really try to get the product into the Walmart store earlier, more rapid, so and prolong the shelf life. And as we get longer shelf life, consumers are going to be more confident in that product. And so I'm seeing those kinds of things. Walmart is, one of the biggest grocery stores in the country, right? So if we can get produce in earlier, make it affordable to folks, make it have a long shelf life, I think that can help address that issue. The second thing you asked is about, the D in the FDA. We are organized in completely separate centers. So I lead the Center for Food Safety and Applied Nutrition. I really have no knowledge specifically about the Center for Drug Evaluation and Research is a completely separate piece of the FDA. So I don't feel like I can really comment on, drugs and the side effects of drugs. That's not what I do. I'm food safety and nutrition.
Great, thank you. So I saw a hand from Josh, and then we have time maybe from Keith and Aaron, and we'll wrap up.
Thank you. I have a quick question. First, I wanted to thank all the panelists for coming in, all the panelists today, and particularly Dr. Main for coming up from the Food and Drug Administration. It's really great to have you here. I have a question for each of you. From your vantage point, what is it that you're trying to accomplish in terms of the American diet? If we think about the goal of the food system improvements, it's to do something to what people are putting in their mouths. I'm guessing that Jason has a relatively easy answer to that, that he can measure pretty clearly. But for Jason, just a little bit more of a question, which is there a way for you to tell whether you're actually growing the market or just beating out your competitors? Like, is there any way that you would know that in your service area, people are actually consuming more? And for Dr. Brunel, as you're thinking about this new initiative, how will you know if you're successful? And I guess for Dr. Main, for all these different things, you've got, your evidence that, there's a good scientific rationale for doing something, but what's the kind of impact you want to have?
Okay, so yeah, definitely sell more produce, sell more, but no, it's there's a couple of parts to that. I'm on a board of Future Harvest Chesapeake Alliance of Sustainable Agriculture, and we are trying to keep the agriculture in the Mid-Atlantic alive. A lot of farmers are retiring, a lot of land is going to other use, and what's exciting is we went from trainees each year in the teens to the 20s to I think 69 or 70 this year. And these are people that have access to land and have the skills and interest and have a chance at taking over agriculture in our region. So if it can be it's not logical to grow everything everywhere, but whatever we're good at, we should focus on. We need to aggregate, we need to add some infrastructure. It is far more easy for my California buyer to buy, in 1 hour can buy 10 truckloads of broccoli, lettuce, celery. My local buyer in 1 hour is lucky to get the Amish farmer on the phone, okay? And and the Eastern Shore farmer, so trying to get that situation with technology, with infrastructure balanced out. But then the innovation has a lot to do, and you kind of mentioned it, the innovation in the fresh cut and the trends in the food. So like I said, 20 years ago and 10 years ago, the better burger chains were all the rage, okay? Now there's literally a dozen sweet greens and other types of salad concepts and kavas and Mediterraneans that are very heavy in produce, which is exciting to see. So from a restaurant trend, not only just the individuals and the fine dining folks are farm to table, but now you see, okay, how is Panera doing it? How is Kava doing it? How is Sweet Greens, Grab-A Greens, and all these other concepts popping up? And then how long will they last? So that makes me feel like we're gaining food consumption, healthier food consumption versus cannibalizing the market. So I think it looks pretty good.
Great.
Go ahead.
And I guess that from our perspective, the first thing is we have to know what our mandate is. Josh knows this as well as anybody. Congress gives us funding to assure the safety of the U.S. food supply. We're responsible at FDA for 80% of the U.S. food supply, and that's both domestic as well as imported food safety. So we have a number of different metrics that we look at and what our goals are. I mean, the big public health goal is to reduce, to make safer food supply, reduce foodborne illness. But the other thing I'll mention is it's not just microbial. We're also concerned about things like chem safety in food and making sure that as we learn about things like, whether it be lead in food or arsenic in food or methyl mercury in food, and we deal with all of those issues all the time, and early life nutrition and how to address some of those issues. So to make a safer food supply, to make a healthier food supply, foodborne illness. On the nutrition side, I think, we are very much guided by the dietary guidelines. And, where are the big deficits and what levers does FDA have to try to impact on those dietary guidelines? I mentioned produce, widely underconsumed in the U.S. diet. So what levers do we have? Food safety is a huge lever there. But we also, I meet with folks like the Produce Marketing Association and others to do what, to make sure that we're hearing from our stakeholders. How do we make sure that we're contributing in that way? The dietary guidelines have nutrients to limit. Saturated fat, sugar, and sodium are the key ones. We have a really important role to play there, and that's through the food labeling. If people don't know how much sodium is in their foods, if they don't know how much added sugar is in their food, how are you going to come into compliance with the dietary guidelines? It's through labeling, it's through reformulation. So those are the big things that we do. We have metrics for what we do. I'm an epidemiologist by training. What I will say is the metrics are really complicated. Simplistically, we can say, let's reduce foodborne illness. But what we've learned is as we've gotten into whole genome sequencing, we are finding outbreaks that we never would have identified in the past. And as we make those outbreaks public, people are like, oh, I ate that food. Maybe I have salmonella, and they go to their doctor, and there's diagnoses, there's detection biases, there's all kinds of issues that come into the metrics. So, simplistically, the goal is to reduce foodborne illness. But what we know is as our methods get better and better and better, we're going to detect more outbreaks. If you see more outbreaks being detected, it's because of the innovative use of whole genome sequencing that we're doing right now. So there's some complexities around that, but that's our ultimate goal, and we do have metrics to try to measure our success.
And Josh, I would respond to your question by saying that we hope to be a constructive force in helping populations move toward a diet that supports human health and well-being on one hand and the environment on the other. In order to do that, we have to think about big-scale policy changes if things are going to change at population levels. And there are some really interesting key elements to that. I mean, one is figuring out what kind of policy should be passed, and others figuring out how to get them passed. And one thing I don't know that we do very well as a profession is telling the human story about why we care about these things. When we're talking about, people don't, I think, understand what the term food systems means, so that needs to be explained. But even more than that, we need to tell the story that, there's a child sitting in Baltimore or Durham who isn't getting enough food and is susceptible to disease and can't learn in school. And that child's die is cast from an early point in life, partly because of the food she or he gets. And there's another child next to that one who's diabetic and may need limbs amputated by the time they're 30. Those are the stories, I think, that we need to tell better in order to generate maximum support for these kind of things. We're good at telling the data story. I don't know we're so good at telling the human story. And that should, I think, be an important priority for the field.
Great. And I know we're over our time, and so maybe super, super quick for Keith. Oh, you're going to pass? Oh.
I think those were great questions and
okay.
good answers.
Perfect. Well, thank you then. And hopefully our panelists will hang around at the end. But let me just thank you all for making the time today, and thank you for the great conversation and discussion that we just had, and really appreciate you being here today. Let me remind you again to do your evaluations, and I'll turn it back over to Ann and Wendy. Thank you so much.
So you're supposed to be able to leave right now, but we're not going to let you leave quite yet. We're running a little behind, and I think since my great idea to put the Post-it notes worked so well, and I was the only person who posted on them, I'm going to ask people to be bold and stand up and share with us. What did you get out of today? Is there anything you're taking away that's new information or something that made you think about what your work differently from a research perspective, et cetera? So we'd really like to hear from you if people are willing to do that in a room of 70 plus people. Start there. Anybody? If I will just say, I'm usually at these more like community food systems conferences, we'd have 1 million hands up. So, we should just kind of get over ourselves. I'll start, okay? One of the things, because it's really important to share this, is to say that it's not about learning everything, but it kept going to my head. Is food a public good? And if food is a public good, where does profit fit in that? And, listening to Jason talk made me start thinking, okay, I don't think we're bringing down capitalism. I mean, that's not a realistic goal. But then we can start to ask ourselves, what are the models we should be looking at that are lifting up really good business practices, and maybe even good business practices amongst companies that are not necessarily selling produce, that could be selling other food products. So that is in my mind right now. Wendy, did you have anything?
Well, I was actually sitting at an interesting lunch table briefly, and I don't know if people from my table wanted to share some of their concerns from the morning for the people. I don't know if you wanted to bring up some of the things that Margot or others that came up at our table about sort of just trying to identify. I think one of the challenges identifying the strongest evidence when there's not very good evidence out there for programs, policies. And so do you want to comment on some of the things that you were concerned about?
Having been called on, I will
there you go.
respond. I think one of the things we talked about over lunch was this tension between wanting to have a very broad look at the food system and think about what's contributing to people's inability to act on their intentions to eat well versus the practicality of what you can actually implement. And so thinking about how challenging it is, I think about the policies that I've worked on, 25 years and we're almost done with trans fat, right? July we'll have trans fat largely out of the food supply. School foods, I've been working on it for like 15 years with numerous local, state, litigation strategies, eventually Healthy Hunger Free Kids Act, and we're still working on implementation of that. Menu labeling, I started working on it in 2003, so I'm 15 years into it. Hopefully in May, menu labeling will be done. And the amount of work that it takes for each of these policy changes is enormous. Building coalitions, building from local to state to national, getting industry to come along, thinking about the changes we've gotten in food marketing to kids, or I brought up the example of McDonald's and the stepwise change of them improving the children's menu that I have not seen within public health nutrition, these kinds of sweeping, comprehensive, system-wide changes. I've never seen a comprehensive nutrition and obesity bill even offered, much less passed, because the amount of opposition that you would have. If I had to deal with the restaurant industry, the supermarket industry, the corner stores, the food manufacturers all at once, I think of how long it took till I got the food manufacturers to agree to trans fat, to restaurants to agree to menu labeling. Like, those were major efforts. And so, I don't know, I would like to talk more about how the practicalities of policy change fit with the need for looking at the system more comprehensively. And for me, it's been more, you plan at the systems level and then you implement at the targeted focus level. But I feel like there's a little bit of tension within my own mind, and I felt the tension here in the room of, people calling targeted strategies reductionists and not worth doing, but also seeing these charts and thinking like, oh my God, if I ever went into a legislator's office with that, there's no way I could talk to them about that in 15 minutes. So I think there's a need for further discussion about how the systems approach fits with political reality.
Or maybe does it? I mean, does it even fit with it? Because are there system solutions? I guess that's kind of, I don't know that we've answered that question.
I don't want to hog the microphone, but I do. The marketing is coming out in me, and that is, marketing 101 is repetition. And I don't know if I expressed myself clearly earlier. What I was trying to say is that there's such a low profit margin with food that at any point in time, I feel like if some imbalance came about, that distributor, that wholesaler, it could throw them off. And then all the work that we're trying to do, me personally bringing a supermarket into a food desert, everything that we're doing, all of our energy and time will have been for nothing if the food industry itself, if the profit margin is so small, it creates a delicate balance between, what the person earns. And so that's concerning to me, that the profit margin in the entire food industry is so small that any disaster could come along and cause an imbalance.
Anybody else?
So in the vein of difficult questions that we're mulling over, I want to just say first, make sure everybody hears me. I do value evidence-based policy, and I do think that's important. But I will say, like in law school, I never heard that phrase. And I also struggle with the fact, or think about the fact that law, we have this rational basis standard, and it's just law has to kind of make sense. And that can be problematical because what makes sense or is common sense to one group may not be common sense to another. But, it boils down to like, how do we kind of balance in the public health field, balance this desire for strong evidence and we want to do what we know will work or what we think will work versus just the realities of trying to make some progress or try things out or what's politically feasible even. Because I know, I value the dietary guidelines. Those are super important and very helpful, but I also know they are subject to a political process. And that, that things were changed in them due to a political process. And so that's kind of the reality, too, of what we're working in. And so I don't have any answers for this, but I think it's an important question, especially for a room full of researchers, to be thinking about, is like, how much resource and time, too, do we put towards trying to find that right outcome versus like just trying to kind of move the ball a little bit, so.
Mm-hmm. I think these are all really helpful questions, and was there one more question? Yeah, go ahead, Chris.
It's a bit more of a comment than a question, but just something I've been thinking about all day. We saw throughout the course of the day descriptions of work being done at every level, on the ground, all the way up to sort of a global perspective of what's happening. And I think we need to get clear on how to work at multiple levels more collaboratively. I don't know that we have answers to a lot of the questions that we're asking, but I think staying in our lanes isn't perhaps the way that we're going to spend money most efficiently and move the ball forward. And I think sometimes we tend to get stuck in an approach that, I'm not speaking necessarily for anyone, but I'm just saying I hear in conversations an approach, we get wed to it, we get stuck in it, when we certainly can do better together. And there's a lot of people working on these issues. Is there a way to work at multiple levels and to work together? And I think there are institutional barriers to that, there's no question, but can we break those down?
Mm-hmm.
Yeah, I also like to make a comment. What we have learned in the field of HIV/AIDS is that it's very important to have a big picture, like a system approach of the problem. But it's not necessary that everyone works together. Because in fact, it is essential to look at the division of labor because it's not, it's almost impossible to be an expert in all these different fields. So you have all these meetings and, yeah, we work together, but that's not necessary. But you need you need a concept where everyone actually has a role to play and that you can measure the impact of each of the different components of it.
Mm-hmm. Okay. So I think that it's nice that in some ways we end with more questions than answers, because it's getting everybody thinking. And hopefully, as Chris pointed out, everybody met people today during the event, and there were definitely a lot of great conversations, and people can leave with each other's cards and connect and brainstorm and have future collaborations that continue way, way, way beyond today. So I really want to take the opportunity to thank all of you for coming together, for allowing us to hear your voices on this issue and to synthesize it with us and really start to think about how we can move forward together. I know many of you traveled far, and I hope that you all have safe travels back. I want to really thank also a few other people. So we had a working group that worked very hard in putting this symposium together. So I want to thank our working group. Many of you are in the audience. Thank all of our speakers for their fabulous talks and doing a lot of preparation in putting this together and in meeting with us several times before the event to make sure that we're organized and the presentations are cohesive. And I want to thank all the folks in the back from the Bloomberg American Health Initiative, particularly Michelle and Josh, for all your support and your help over the last few months in putting this together. It's been a lot of fun for me and Ann to work together and get to know each other, even where we didn't really know each other before this, so we're getting the opportunity to collaborate and work on something new, which is really exciting.
And then I'd say, too, big thanks to Akola and Dory and Faria, because I hate doing events. And so the last, like, someone says, let's do a conference, I'm like, oh my God, this is like debating my existence. But this was so nice to have all of things in place. And Julie, who works with Wendy, did fabulous work. So I really want to thank you. And then if I want to keep my job, I better give a shout out to educational curriculum that our center has done. So I heard a couple people talking about they want more education. And they want to be able to, get basic level, even food systems education. And the center has produced a curriculum called Food Span, which is aimed at the high school level. And for a lot of these topics, that's kind of the level you need. And so I encourage you all to look at it. It is really interesting and fun and very engaging and interactive. So I definitely needed to mention that before we left. And I want to thank Wendy again. So thanks, everybody.
All right, thanks, everyone.